Hi, this is Dr. Stephanie Wautier, and I'm the host of Conversations with a Chiropractor. This is not a health how-to, but rather a conversation with some amazing people I've had the pleasure of being with on my journey of life. Think of it more like Tuesdays with Maury, a fireside chat, or chicken soup for the soul. Grab a cup of coffee, sit back, and enjoy this conversation with a chiropractor. Welcome back to Conversations with a Chiropractor, the show where we explore real conversations about health, healing, and thriving through every season of life. Today, I am thrilled to welcome back my very special guest, Dr. Jill Balla. Dr. Jill was featured on episode 6, so if you haven't listened, maybe listen to that first. You'll hear a little bit about her journey. Dr. Balla is a chiropractor and functional medicine doctor based in Traverse City, Michigan. She is the founder of Authentic Health, a wellness practice devoted to helping people heal from the inside out. Dr. Balla takes a deeply integrative and personalized approach to care, blending diagnostics with holistic therapies. She supports women's health, adrenals, immune system, gut health. In this episode, we are diving into a topic that deserves way more attention: menopause. From brain fog and hot flashes to mood changes and hormone therapy, Dr. Jill and I are going to be unpacking what's really going on during this stage of life and how women can feel empowered, informed, and supported through this transition. Whether you're in perimenopause, postmenopause, or just starting to ask questions about what's ahead, this conversation is for you. Let's welcome Dr. Balla to the show.
Thanks, Steph. I'm glad to be back.
Yes, you are such a wealth of information. And, you know, this is happening to both of us right now. Yes. So interestingly enough, we're gonna start doing some statistical stuff. It's so interesting. The menopausal transition most often begins between ages 45 and 55, and it usually lasts about 7 years, but it can be as long as 14 years. And what I found on the internet, the duration can depend on lifestyle factors such as smoking, the age it begins, even race has an effect on this. I don't think most people think that women are going through this transition for 7 to 14 years.
Women are always transitioning. You know, we're always moving from puberty to reproductive years to the reproductive years dwindling. You know, the women who decide they want to have children at 35 and then are finding out that things don't always work out for you.
Mm-hmm.
And then you start to head into menopause and perimenopause. And I had a discussion with a close friend of mine. She's like, how can you say you're postmenopause? Aren't you menopause? And to distinguish that there's a point in time when you cross over, menopause is a point in time. And I just think that's such a small way to think about it.
Mm-hmm.
You know, we're between your adrenals and your liver function and your gallbladder and marriages and ending of marriages and children and graduation and grandchildren. We are constantly moving through our lives and our hormones. What I've discovered is the healthier I keep my liver, the lack of hot flashes I have. Right? So when you start connecting all these symptoms that people talk about to your actual health, how your adrenals are functioning, how your mental health is, how your liver is functioning, how your thyroid is functioning, what is going on physiologically, what is going on emotionally, and what is going on mentally is going to change your hormones as you move through your life.
Mm-hmm.
It isn't these hard set times.
Yeah.
I've had patients who've come to me and they've 5 years post-menopause, and we start getting in there and supporting the hormones and their liver and their adrenals, and they have a period again. And they're not very happy with me because they want to be done with it. But I just point out your body wasn't done.
Yeah. Yeah. So that is the classic traditional Western
Right.
medicine definition.
Right.
I'm going to list off some common symptoms of perimenopause, menopause. So a lot of women experience hot flashes, mood swings, irregular periods, different vaginal issues, weight gain, night sweats, low libido, headaches, joint pain, dry skin, bladder issues, hair loss, brain fog, bone fragility, depression, anxiety, fatigue, irritability, painful sex, facial acne, trouble with sleep, heart palpitations, frequent UTIs. These are the quote unquote most common symptoms of this time in our lives.
Yeah.
And we're talking symptoms, we're talking medical. And I know we're going to sort of delve into the health of the human body, the health of a woman's body. But, interestingly enough, my first and most bothersome symptom was brain fog. In fact, I would become, I would say, dyslexic. Like I would have a patient face up. Let's say I was working on their left knee. I would flip them over and I would literally have to think left and right. Now that's pretty humbling and frankly embarrassing for a woman, a doctor of chiropractic who's had 18 years as a chiropractor, 12 plus more years as a nurse, to not be able to tell her left from her right. I mean, that was startling. Like what in the actual HE double tune pick? So I know that Western medicine, there's and people come to me and they're like, what can I do? What can I do?
Yeah, I think if we took a different approach, if we looked at it differently and started with not chase symptoms, right? Because I think that's one of the things that distinguishes functional medicine or alternative medicine, the chiropractic, however you want to look at it, whatever you want to call it, is to get to the root of the problem, right? Instead of how do I get rid of hot flashes? Well, what are the hot flashes telling you? How do I get rid of brain fog? What's the brain fog telling you?
Yeah.
So the other thing is it's menopause is sort of the accumulation of all the bad stuff your body has endured, right? And those hormones start shifting and women take a different approach, right? Their brains actually change. And that helps us to have more clarity about our situation, but we also have to recognize our liver has been clogged up for years. Our adrenals have been beaten up. Our thyroid's getting dragged down likely by our adrenals. We've had heavy metal exposure. Our gut health might not be optimal. We start to look at the actual physiology and what we can do to support the physiology. We don't spend our time chasing symptoms or actually supporting how the body is supposed to be healing and functioning.
And I'm going to say, this is what you do. This is what you in your functional world do. But most people are desperate for a quick fix. They're desperate for a solution. And I think sort of the word on the street is, do we do hormone replacement or not? And we're going to go back to what you do in a little bit, but I want to spend a little bit of time because I feel like this hormone replacement therapy stuff has been so controversial, right? Like there have been more than 5 studies that wanted to see, is hormone replacement therapy carcinogenic? Is it better for us or worse for us? So as a registered nurse myself, I've always been really interested in this 1976 Nurses' Health Study, which followed over 120,000 U.S. registered nurses aged 30 to 55 through several questionnaires on health, lifestyle, and medication use. And one of the things that they were looking at was, well, what does hormone replacement therapy do, right? So the estrogen-only therapy showed reduced risks of non-fatal heart attacks, strokes, and cardiovascular mortality, but then they had a higher risk of having breast cancer and And stroke was a very, very scary and life-threatening risk that the hormone replacement therapy was shown to have as a side effect. There was another study done by the IARC, which is the International Agency for Research on Cancer. It's a subsect of the World Health Organization. And they did a 2005 study on combined oral contraceptives and then combined estrogen, progesterone, menopausal therapy, which is HRT. Unfortunately, they were both classified as group 1 carcinogens. They stated it is carcinogenic to humans based on sufficient evidence that these hormonal combinations increase the risk of certain cancers, particularly breast, cervical, and liver cancers. So I think that now what we're seeing sort of in this mainstream media with other different hormone replacement therapies is they're saying, well, they didn't use the micronized progesterone. They didn't use the specific thing, or we would never use estrogen only, or now we're going to put testosterone. So like, I think right now what a lot of women are like, okay, how can I do hormone replacement therapy safely, naturally? And I think some of these studies, which, yeah, this is 20 years old, 1976, decades and decades old, almost 50 years old. What is like the newest research for is hormone replacement therapy safe?
I mean, it's unfortunately, it is, women are told that don't worry about it, because once you get to menopause, you do hormone replacement. Because who wouldn't want to do hormone replacement? Keeps your skin soft, keeps, da 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 da. And we in school in our toxicology class, you, me, and Abby did a presentation on Premarin, right?
Mm-hmm.
Do you remember that?
Yes.
And that was like mind blowing to me that this product had got put out on the market. So the problem is that any external hormones going into the body is going to downregulate your own production of hormones, right? And we already have a hormone production problem, right? Because ovaries start to shut down naturally, the adrenals are supposed to take over. Well, in this world we live in, especially as women, we've beaten up our adrenals, and the adrenals don't have the capacity to produce the hormones they're supposed to in menopause just because they're tired, right? So now we've got hormone replacement therapy, right? And it's better because we're doing estrogen, progesterone, and testosterone. Well, how much? How much is too much? And now, do I need DHEA? Do I need pregnenolone? Do I need the precursors to make the hormones? And they don't want to give the hormones by mouth because that puts you at higher risk for stroke and blood clots. But it also runs it through the liver, which offers a level of protection.
That's when it's taken orally?
Yes.
So what we're talking about is a transdermal patch and or a pellet that is inserted into the...
Or the cream.
Or the creams.
Or the creams. So the problem is anything going through the skin, you can't dose it. You don't know how much they're going to get exposed to on a daily basis. Because if I put a cream on today and I put a cream on the other arm tomorrow and back and forth, I could stop using the cream and it may take up to 6 months for it to fully get out of my skin.
Does it matter how much fat tissue someone has?
Which is why the oral was better, because they could actually measure how much you're getting exposed to. But now but then you have the risk factors. So there are times when women are in such bad shape that, of course, I don't blame them for doing this. I don't want women to get to that point.
Yeah.
But if you get to that point and you need to use hormone replacement, then use it with the idea that this is not for the rest of my life, right? Because it's got risk factors.
Yeah.
It does have risk factors. And it's not going to make everything all better, right? If your liver's plugged up and you're dumping in all these external hormones, your liver's going to get more plugged up. But anytime I have a patient who's on hormone replacement therapy, I'm not the one taking them off of it. And I'm certainly not suggesting that they come off of it. I don't want to pull the rug out from underneath them.
Yeah.
But they have to get some liver support so their body can process those excess hormones.
Yeah.
So they're not keep swirling around in the body. So those are the things that I think get missed when talking about hormone replacement. Is it good? Is it bad? Ideally, you wouldn't want to need it.
Yes. But so many of us do, right? So many of us are having these symptoms. And I think that people are frustrated because, and I don't want to throw any profession under the bus, but I think OBGYNs have had very, very little experience and education in this perimenopause and postmenopausal time in a woman's life. You know, they're very, very focused on cancer screenings and delivering babies.
Sure.
And I mean, I love my OBGYN friends, but we can't pretend that they're the experts in this. People are desperate to find someone who is an expert in this, who has the answers.
Well, when you look at women's health in general, it's just been ignored. For so long, women have been excluded from study after study after study, almost every drug study until the 90s. They finally started putting women into the drug study because we had those pesky hormones that messed up their perfect little studies.
For other drugs, like because there was the 1976 study for the hormone stuff, but
but no, like just general drugs like Ambien. And, you know, when Ambien came out, and then they discovered several years later that, women should probably be taking half the dose.
Wow.
Because of our hormones. All the cardiology studies, they excluded women. And you're like, right? So how very little studies have actually been done on menopause? When have women really been the focus on looking at all these hormones in different stages? Even fasting, right? Even fasting was studied only on men and postmenopausal women. Right? And they're like, intermittent fasting is great. It is great when you do it according to a woman's hormone cycle.
Yes. I'll never forget, you recommended a book to me and I read it and it was on fasting. And you said, Stephanie, wait, stop. That book was based on research that was not done on cycling women. Women still having a menopause, or excuse me, a period, you know?
So, I mean, thankfully there's women emerging with books on how to fast for women. And they're really quite impactful. My current favorite author is Dr. Menopause. And she has a book called Fast Like a Girl and Menopause Reset. They're just beautiful, loaded with information on what you can do to actually reset your hormones, reset your gut, reset your brain. I mean, it's staggering development of information on like things women can do for themselves to heal. And then, you know, you can always add in the plant stuff. We use wild yam, we use some rhubarb extracts, stuff like that. In addition to the liver support and the adrenal support. And then there's heavy metals, right? The heavy metals, the lead gets into the bone, the mercury gets into the thyroid and into the brain, the aluminum in the brain. Like there's so many other factors going on. And if we just go chasing the symptoms, we lose the plot. If we miss the heavy metals, if we miss the adrenals, miss the liver, miss the thyroid, we aren't going to solve the problem.
I think so many of us just naturally, and maybe when I say so many of us, I say so many of us women, so many of us busy working women, we wait until we can't turn away from it anymore. We wait until that symptom is so loud and so altering to our daily lives that then we have to address it. I mean, this is probably what most humans do anyways, right?
Most women.
Right?
You're taking care of kids. You're putting your kids first, your partner first, your business first, your parents, right?
Mhm.
Not only are we in the stage of children graduating and raising them and helping them become full adults, now we're taking care of aging parents,
Yeah.
right?
Yep.
And then our hormones are changing, and we're losing those accommodating hormones, those nurturing hormones, and we're starting to get a glimpse of ourselves. And all these things are crashing in together at one time.
Yeah.
Right? So no wonder.
Mm-hmm.
No wonder you have brain fog. No wonder you're screaming off at your family. Right?
Yeah.
Why wouldn't you?
Yeah.
Right?
Yeah.
So that's I don't want people to not have hope.
Mm.
And especially if you've got family history of cancer, female cancers, you may not want to dip your toe into the hormone replacement therapy, or right?
Yeah.
But
yeah.
what are you going to do? And that's really meat and potatoes for me. That's what I love. So.
Well, and I know because I've been your patient and my family has, like, I know that you specifically have a very, very whole human approach. This isn't someone coming in and saying, I'm having hot flashes. And you say, here, take this pill.
Yeah.
You're looking at every aspect of their physiology. And I mean, let's also say mental and emotional and spiritual factors are playing a role as well. Yeah.
It was interesting. I had a recent patient, and we're working on helping her sleep. And I just wanted, we're going to try this, and we're going to see how it goes. And I would say 25% of people respond well to this. We just have to figure out what it is for you. What are the factors that are affecting your sleep? It could be a whole range of things.
Yeah.
Same thing with hormones. What are the factors that are affecting your hormones? And so after having a practice in Illinois for 15 years and starting anew in a different city, it was like, what do I want to do? What am I most passionate about? What gets me up in the morning? And really having a more of a boutique office where we really are looking at the individual. I think that changes results. If just give a canned protocol, it's not going to, you're not going to have the same results. But everybody can support the liver, green leafy vegetables, fermented foods, laying off the alcohol. I mean, women, I can't tell you the number of women who've noted, I can't drink like I used to before I started to shift into menopause.
Wow. Yeah.
And because the liver's just, I'm not tolerating this anymore.
Yeah.
So I think there's so much you can do. There's so much you can do to help your body, heal your body, support your body. And then if, you need to move into some plant-based hormone therapies, or not hormone therapies, plant-based hormone support, you can do that. That often helps.
You're talking about like herbs, right?
Yeah.
For our listeners.
Yeah.
And most of your other like foundational products are all whole food organic supplements, right? To support specific organs that are in crisis.
Yeah. Feed organs, support the physiological process. And then the herbs come in, and herbs come back to as a catalyst,
like more short term, more like acute.
Right. Wake the system up, which gives us time to get the whole food supplements in there to rebuild the organs and the systems. And homeopathics are fantastic too. We always layer those in. They come in. They all fit a different facet of healing, but also then lifestyle. And, really cleaning up the diet and going for, try some fasting and going for different healthier foods and leaving the alcohol behind. And, a new study out that Dr. Amen was talking about is showing cannabis is impacting heart health.
Interesting.
And a previous study, it's impacting mental health and brain function. So I know people use it for a lot of different things and it's helpful to them. But when we start to really, how do we plan for the long term? And so encourage women who are younger in their 30s. And I always tell women, when I see a woman who's 20 in her mid 20s, and I say, is children something you'd like to have in the future? You're not telling, it doesn't have to be now, but
right.
And they're like, yeah. I'm like, I want you to understand that you want to get off this birth control pill as soon as possible and help your body restore its natural function. Because when you're 32 and you can't get pregnant, it'll be devastating. You may not care about it at 25, but when you're 35 and you weren't able to have children, that's going to change your life.
Yeah. Can you talk to us a little bit about why birth control isn't the best, what it's actually physically doing in our bodies?
So like hormone therapy, you're putting external hormones into the body, plugs up the liver, but essentially what birth control is tricks your body into thinking it's already pregnant. And so when the body is not used to the process of signaling pituitary, ovaries, adrenals to thyroid, adrenals to ovaries, thyroid to ovaries, thyroid to pituitary. That is the HPA axis system. When that system isn't allowed to function properly, the body has a hard time kind of restarting that. Plus, you're plugged up with all these external.
Yeah.
And so,
would you put a woman who's come off of birth control on like a specific cleanse? I mean, I know cleanses are like a fad and all the rage, but would you specifically have a protocol for these women to get that exogenous hormone out of their body faster?
So the way I approach cleanses is you have to almost earn your way into being able to do a cleanse.
Interesting.
I don't ever throw anybody on a cleanse. They have to be a patient who's been a patient at least 3 or 4 months. We've made sure that there's not a parasitic infection. We've made sure that the liver is actually functioning somewhat properly, their adrenals, because going on a proper cleanse, like don't ever do a 3-day, like
Juice cleanse or
that lemon juice and cayenne, right? It is so easy to get the body to push out toxins. It is the cleanup that is the difficult part. And so all these people are like, oh, I went on a 5-day cleanse or something. I'm like, you just stirred up the pond water and you've got, nobody's flipped on the filter.
Yeah.
So typically I'll put people on a 3-week cleanse where the first week they're dumping and the weeks 2 and 3, it's cleanup. And I say, you cannot stop this.
Yeah.
You can't stir up the pond water and then not turn the filters on.
Yeah.
Because you're just going to make a huge mess.
Absolutely.
And so I don't tend to throw people on cleanses until they're mentally and physically ready to detox.
That's profound, because I think so many people, and I hate to keep bringing this up, but we're looking for quick fixes, right? We're looking for these symptoms to go away and or get better fast, right? Fast, fast, fast. We got to do this fast, Jill. We got to do this fast. We can't take the time. I can't do something for 3 weeks. I can't be that like disciplined. I mean, and this is the unfortunate thing, I think, with a lot of the internet, is that these companies are popping up and they're offering this quick fix support. And it's really, really confusing women. So, Dr. Balla, I want to talk a little bit about, weight and fat cells. So we know that hormones are stored in our fat cells, and so are toxins and all kinds of other things. So like, what happens when all these women and men are losing weight so quickly? What's happening to the contents of those fat cells?
Yeah. So fat cells are, we know, part of your endocrine system, or I guess you and I know are part of our endocrine system. Other people might not know, but your fat cells are part of your endocrine system. And we may hate them, but they're protecting us. And that's what I was talking about stirring up the pond water. The fat cells, if there's a toxin and the body can't get rid of it, if your methylation pathways aren't open and your liver can't get rid of the toxins, the body tucks it away. So tucks it away into a fat cell. It also does that with hormones. So we know women who are overweight are carrying more estrogen. And how do they carry estrogen? They carry it in their fat cells. And so the GLP-1s are new and on the market, and a lot of people, especially women, are having success with losing a lot of weight very quickly. That is to be expected, exposing themselves to excess estrogens. So any patient I have who's on GLP-1s, we're supporting liver, we're supporting thyroid, we're trying to help with that digestion so the food's not sitting there. We want to keep those pathways open so the body can detox properly. And so that's another reason I don't throw people on cleanses, right? Are their adrenals strong enough to get rid of, help the body push? It takes energy to get rid of these toxins.
And if they don't have the pathways to excrete them, they are going to get sick. This toxic overload, for lack of a better term, is going to create illness within their body. And I do want to say one thing here. You and I both have had amazing experience with the Zirconia lasers, and Glow Laser Aesthetics does have 2 different fat loss lasers. And one thing that I really love about them is that they shrink the fat cell. They don't freeze it. They're
not damaging. They're not damaging the endocrine system.
Exactly. It's like very healthy. And, we push what you need to do in your lifestyle, like drinking lots of water and movement for lymphatics, because we do know that the contents of that fat cell have been excreted into the interstitial system.
And the nice part of the lasers, I have one, you guys have better ones, but I have one as well, is it's taking layer by layer. It's not causing a big dumping, or it's not allowing these fat cells all to deflate at once. It's taking it layer by layer. And we know the lasers have also anti-inflammatory, they're healing lasers as well. So it allows the thing to be nice and easy, slow and steady, not overwhelming the pathways, not overwhelming the liver. So it's like, it sort of goes back to that quick fix thing we were talking about, right? The quick fix is never going to be probably the long-term fix.
Absolutely.
And even if people use the GLP-1s to get them kind of started or over the hump, if they go into it knowing, I don't want to be on this forever, I want to start to rebuild a foundation underneath me so that when I do come off of it, I'm still successful. And the GLP-1s, I think, are highlighting this problem, and it's how much sugar and carbs and how many times are spiking our insulin. The spike in insulin creates the fat cell, right? Because the body has to do something with the insulin. So again, going back to the fasting really starts to get at the spiking insulin. The low carb diet is going to be the way of the future for anybody, especially women as they age. Right?
And when you say low carb, we are not talking about something that has an artificial sweetener.
No.
We are not talking about the low sugar yogurt or the sugar-free syrup.
It's another form of a toxin. Right? And even encouraging people, I get asked a lot, is stevia okay? Is monk fruit okay? Yeah, they're okay. They're better. They're a transition. But you really should get to the point where you can drink coffee without a sweetener. Right? Coffee is actually fantastic liquid. It does great things for your brain. It actually helps to balance your estrogen.
I love coffee. I love it. Coffee is my best friend.
It's just what we put in the coffee.
Yeah.
Right.
Right.
And so you can, when I got off of putting sugar in my coffee, I went to stevia, and I did that for a while. I did that probably for a year or so.
Mhm.
And then I just started using a little less and a little less and a little less. And then I was like, I'm good,
Mhm. Yeah. Yeah.
So,
And I want to say too that we cannot look at a human on the street and guesstimate their size or guesstimate their weight and think they are unhealthy because they're this much and the skinny person is healthier. That is not an equal, like, oh my gosh, you weigh 120 pounds, you're so healthy. That person could be eating nothing, no protein, have no muscle mass, be having like cardiac arrhythmias.
yes.
We can't equate. I know Western medicine loves to equate the number on the scale to your health. That is one number in the myriad of ways that we can assess a woman's health. Yeah.
And I mean, we know that women who have more body fat do better with going through cancer.
Interesting.
So, I oftentimes I think people who have more body weight on them come in and do better with supplementation and staying on track. Because how many times have you tried, right?
Mm-hmm.
But skinnier people who are just naturally thin, they've never had to struggle.
Mm-hmm.
And they just don't think they're sick. Or they just don't think that anything's wrong.
Right.
Because look, I'm thin. Everything's okay.
Yeah.
And they can have terrible hormone problems too.
Absolutely.
And they can be totally addicted to sugar.
Yes.
But it's causing different problems for them.
Mm-hmm.
So I think that's a great point, is being thin doesn't mean you're healthy, and being fat doesn't mean you're not.
Absolutely, Jill.
And when, poop hits the fan and you have a tragedy, somebody's sick, something pops up, in the end, it doesn't matter what size your pants are.
Yeah.
Right?
It's absolutely.
What's the quality of your life? How's your mental health? How's your emotional health?
Yeah.
Can you move through your world in a peaceful way?
Mm-hmm. Yeah, that's beautiful. Yeah. At the end of the day, does what you see in the mirror matter?
Mm-hmm.
Does the size of your clothing matter?
Yeah.
Does the health of your relationships matter?
And I think we talked about that. A lot of people are discovering that with the GLP-1s that they lose all this weight and everything's still there.
Their soul doesn't change.
And we saw that with people getting bariatric surgery as well, that the addiction problems just moved, changed, shifted. All the other stuff was still there. And so if we can embrace more of a slow, steady healing approach versus quick fixes, we'll get there. And you and I talked about last night about how long we've been working through issues, emotional stuff from childhood, right? Slow and steady, and how much growth we've had in the last just 5 to 7 years.
Yeah.
Right?
Absolutely.
Embracing ourselves, embracing our role as wives and you as a mother, and also who are we now?
And really honoring and acknowledging the journey that we're on. And I my new favorite woman podcaster is Regan Hillier, and I'm going to give her a shout out. I love to think like we're becoming our highest self.
Yeah.
We don't arrive at one point our higher self. We are constantly striving and becoming our highest self. And part of that is giving ourselves grace and loving ourselves.
Part of that is also the shift in our hormones, right?
Yeah.
We lose those high dose of hormones that created us to be accommodating and nurturing and taking care of everybody but ourselves.
Yeah.
That starts to shift. And that is also a beautiful thing.
Yeah.
So I don't like to, a lot of women are like, oh no, this is happening.
Like, oh, this is the end of my life.
Right.
I'm not a child rearer. I'm not young anymore.
You're so much more.
Yes.
Because you've had all this lived experience and you have wisdom. In indigenous cultures, there were native tribes who, once women went into menopause, they become the elders. They become the wisdom of the tribe.
They become revered.
Yeah.
They become honored.
Right.
Yeah.
And so the shift in the hormones, when we can do it in a healthy way, is graduating, becoming that higher self. And we talked about before, my mom would comment about how sorry my grandmother felt for her for having all these menopause symptoms, because my grandmother didn't have any symptoms of menopause.
That is like mic drop, mind blowing.
So she just transitioned.
She just transitioned. And you also told me, when you're like sort of studying some of these indigenous tribes, that they did not have these symptoms that we currently have now in our 2025 Western world culture.
Right. So when they look at indigenous tribes, the women don't exhibit heart palpitations, thyroid problems, brain fog, hair loss. They don't have those things. So where is this really coming from? We know our food supply is just garbage. We know we're getting exposed to xenohormones and toxins and pesticides and plastics that, God help us, we're also with microplastics now. And those are all putting out these fake hormones. So we're living in a rough world for an endocrine body.
Yes. But I mean, I want to like really, really, really hit this point home. Indigenous tribes and your grandmother and probably many other women did not have the symptoms that we have now.
Yeah.
I mean, yeah. So we have
to not have to,
like the earlier you start,
the earlier you recognize that you matter. You need to take care of your health, your energy, your sleep, all the things. The earlier you recognize that, the number of times you resist overscheduling, the busy woman phenomenon, right? We almost have busy porn, right? Women comparing notes about how busy you are versus how busy I am, right?
Oh, yeah. Oh, you have the day off? Oh, must be nice. Oh, must be nice.
Yeah.
Like there's like this badge of honor for being a workaholic. Yeah. There's this badge of honor for being busy. Yeah. I mean, and I don't mean to be a ASS, but sometimes I have people who have like a 5 and a 7-year-old and they're like, oh, we had soccer and we had this. And I'm like, wait till you have a junior and senior in high school who are both like, one is a super musician, one is a super athlete. Girl, you ain't going to get your laundry done. You ain't going to keep your house clean. Right. Like you are lucky that you put food in your mouth that has any nutritional value. Right. I shouldn't say lucky. Everything's a choice. But like, and I mean, did you see how I just became a victim right there? Yeah. Yep. I'm getting over that. But we do this. Yeah. We do this.
Versus, you talking to a mom with newborn twins who's got poop on her shirt in the shower, right?
Yes.
It's become this cultural thing.
Yeah.
And I think it is, we see the ramifications because when we're young, we have all the energy, we have all the hormones, and we have all we can gut it out. Mm-hmm. We just talked about, a woman just gets things done, right? Stop talking about it. Just get it done. Just bring the air conditioner up from the street.
Exactly.
Right?
Yeah.
But we need to recognize that it's causing damage.
Yeah.
And be aware of that and resist the busy porn.
Yeah, absolutely.
And support each other.
Yes.
Good for you. You got a day off. Good for you.
Yes. And yes, you're busy. You're beautiful 5 and 7-year-old. Take lots of pictures at that soccer game. I actually do always tell my patients who are moms, my scrapbooking hack, anyways, I do support them. I'm just, I'm being a little exaggeratory. But, Dr. Balla, in closing, I want to say that if anyone wanted to reach out to you specifically, you do take telehealth patients.
Absolutely, yeah.
They
I would
don't.
say probably half my practice is telehealth. Um, it's not. I mean, it's great if you come in the office. That's fun. It's nice to see people in person, but a lot of people can't pull that off, and that's we can get a lot done over the phone. So
Wonderful.
yeah.
So how do people find you online?
My website's AuthenticHealthLLC.com. And there's even a little button for telehealth, and just call, text, email. However, I'm kind of I'm a little boutique now. So and I love that. I love having the kind of slow and steady practice where I get to really engage with people, and that's what fills me up.
It's a gift.
It's not going to be, okay, your first month you do this, and then your second month. No, I don't. Everybody's unique.
And for our listeners, like in the chiropractic world, there's a quote unquote, like a high volume practice where someone will just adjust and just see you and patient after patient. And when Dr. Balla is saying boutique, she isn't saying she's asking you to pay $1 million.
No.
What she's saying is that every human is treated as an individual. You're going to get a different kind of time and attention, like going into a boutique versus going into Target or Walmart. That is like the differentiation, if you can visualize that.
Yes.
Boutique doesn't mean that she's charging $1 jillion.
No. And over the last 3 or 4 years, I have learned more about ADHD and realized, well, whether or not I have a diagnosis, I could care less. But honoring that is how my brain works. And knowing that's how I started practice, where I couldn't do nutrition all day, it would be boring to me. I couldn't do adjustments all day. I like that dynamic. Part of being able to do nutrition as much as I do is the individual and the unique aspects of each individual, and having to use my brain and think about, I've seen this before. They tend to respond this way, or this is totally new. One of my favorite things to do is autoimmune disease, because it affects 90% of women.
And you're seeing women through the lifespan.
Yeah.
You love babies, pregnant women.
Cases. I absolutely love doing fertility cases. I just talk to you, like, getting to adjust new babies, but also supporting moms with what to start with food and what to look for, and why does my kid have eczema, and why is my teen girl suddenly exhibiting scoliosis? That's a hormone thing, right? We got to jump on these hormones. We got to get this. You've got to get her hormones balanced, so her spine doesn't curl.
Yeah.
So there's so many aspects of each life stage. It's not like, oh, when I get past menopause, I don't have to worry about it.
Yeah. Like this happens, then this happens. And I think, and hopefully what our listeners are hearing, I'm going to say something to the men. Men, your partners are changing, and what they need is compassion, and what they need is for you to honor that.
And then what they need is for you to take on the mental load that they've been carrying.
Yeah.
That is really something that I think is starting to get recognized. How much mental load. They're like, well, just tell me what to do, and I'm happy to do it. She's not your project manager. If you're experiencing turmoil in your marriage because your partner is going through hormone changes, probably you're not taking on the mental load.
Yeah. And then, what we're saying to women is, don't wait for the symptoms to be so bad that you can't function. Don't wait until you're having hot flashes at night so bad that you're not getting sleep, and then that's creating more irritability. We're saying, and hopefully you hear this, honor yourself, love yourself. Be good to yourself, no matter what age you are, no matter what phase of life you are. And just because you haven't had a period doesn't mean you're the old gray mare that's out to pasture. Honor this,
You know,
yeah,
you're the wise
revered,
woman who's got a lot to say.
yeah, who's got a lot to offer the world. Dr. Balla, thank you for your beautiful, beautiful wisdom, your insight, your time.
I love talking to you.
AuthenticHealthLLC.com is Dr. Balla's website. You can find her on the internet. Thanks, Dr. Balla.
Thank you.
Thank you so much for listening. If you've enjoyed this podcast, would you please rate it, review it, like, or subscribe? You can find me on social media at wautierwellness.com, Dr. Stephanie Wautier on Instagram, or Wautier Wellness Chiropractic and Massage on Facebook. And I'm so curious where your next conversation will take you.